Want to double your impact in the women's health and Femtech space? We will tell you how today. Hannah and Amanda were able to share how they, as the trailblazer in the Femtech space, able to use unconventional ways to scale the business and gain additional investments. Welcome to Provider's Edge, the podcast that helps healthcare entrepreneurs and innovators break down barriers and control their business, life, and future with valuable action steps. With me, your host, Sabrina Runbeck, a recovered clinician and a business deal catalyst. Let's rewrite the rules and create a positive social impact while increasing your profitability. I was fortunate to be invited as a host for a Femtech Consumer and Innovation Summit back in June. We had a session on how do you leverage the current trend and continue to evolve your company to make sure you can penetrate the market and then become a leader in the market. I was able to interview two amazing founders, Hannah Samano, who is the CEO and founder of Unfabled, is a platform for women's well-being services and products to be curated in one place. And also Watters Gorman, who is a pediatric nurse practitioner turned entrepreneur, launched her platform, a telemedicine service to help both mother and baby to provide lactation support. Both women had shared both from their authentic self of how they changed themselves to seeing resources and gaining funding and being able to collaborate with other entities and companies for them to be able to move forward. And we did discuss how do you leverage different strategies to put yourself on the map, whether you are a small company that really need the entire community social media leverage to prove a concept, or you're able to establish yourself by leveraging higher level of funding and growth. Stay tuned.
I know these women are out there. I know they're in their glider, the $600 glider at 2 a.m. with a baby who's crying, and they're crying, and they have their phone. And I know they're Googling like mad, but they're not Googling breastfeeding help video, breastfeeding help, telehealth. So how do I reach them? And at the time, I was trying to go through their providers, but they were looking at me like I had 10 heads too. Why aren't I do that? So we had to kind of go through that novel. We know where they are. How do we reach them? And that's where I kind of said, all right, digital marketing is going to be where we're going to have to try to reach them. And in my case, I was lucky enough to find a really good partner in digital marketing who didn't think I was crazy, and who started, in my description, kind of creating the underground subways in the form of SEO, all these new acronyms I've never heard of, backlinks, content. I tried to write a blog once and I was like, oh, it's time to farm this one out. This just took 7 hours of my time. And so in our case, he did such an amazing job at creating those subways, such that when COVID did hit, light switch, that first lady, probably in New York City, who typed in telehealth breastfeeding, they came right through the tunnels. So you had to be creative and go out where you know those people are looking. And in the instance that you have 10 seconds to explain what you're doing, even though it's novel and they might not understand it, you've got to sell it and identify with them and be really creative in your word choices because you have 5 to 7 words to do it, typically.
Right, and it's playing into the social media market of how do you capture attention when nowadays there's so much out there. However, when you do it right, when you actually fine tune them, understand based on what Amanda said is we have to research that. We have to go and meet people where they are. And perhaps it's just the short 2 words that capture the initial interest, then creating the right content to go forward. And for you, you were smart about it. Let's go to consumer directly. Like, let's get the bus going. And sometimes, especially with a product or service that's direct to consumer, you can do that. Versus some other technology that's more interoperability, it can be more difficult to do. So like Hannah shared a little bit of her experience. How did you get started?
Yeah, I mean, I think one unfair advantage that we all have in this ecosystem is that usually we are building for ourselves. And so I think that it means that given the unfamiliar experience, you can actually get quite a long way in the early days with quite a little, because you have probably a lot of assumptions that you need to move through, but you also really can just trust your gut quite a lot, and that was really what I felt when I started the business. Firstly, I felt like I was really ready for a different kind of consumer experience around my health and wellness. I was used to very glossy and digitized experiences for things like my skincare, and then I was going to find period products in the supermarket and dusty shelves, and I just thought that it was crazy actually that these areas of our personal care weren't consolidated and connected. And so selfishly I wanted an experience that felt sleeker and nicer. And I also was very curious at the time around the data on products and what was working well in the market, because in the UK I'd seen this mushrooming of new innovations around consumer health. I had no idea of all the different period products that were popping up and supplements and all sorts, what were people actually buying? So I, in the pandemic, just spun up a really quick Shopify site by myself and was really pleased when I started reaching out to wonderful brands really established today, like Today, for example, has been a partner since day one. And I was curious, I thought, if I tell them that I'm going to build a curated marketplace of female health products, will they say, oh no, I don't want you to put me alongside my competitors in one home? But no one's ever said that actually, because I think that if you are building a consumer brand for female health, you know that that is now inevitable. And actually in the last year, we've seen Sephora start to roll out ecosystems for female health. But when I started the business, the likes of Sephora were not stocking period care, they were not stocking sexual wellness and so on. So I feel I was able to start from a very personal place in building that out. And then something else that has helped me in the business a lot, I think is quite a common thread with all of us, is community. And so I started in the early days with an Instagram page where women would start telling me what they were looking for and asking what is the best product for X symptom or need. And then I would do the research and speak to some medical friends to do the vetting for them. And then that really has ballooned, and what has helped us massively has been TikTok also along the way. We've reached 50 million women organically, and for us that has been an incredible way to be in conversation with the user and to know really ahead of time what people are talking about, what conversations are they having, what products are they talking about or ingredients, and so then we can be able to use that community science to continue evolving the platform and our product offering much quicker than anyone else in the market.
Right. What you mentioned is definitely the community building part, because if we have the right mindset to say it's not a competitive world, actually we can support each other. And what you have built to collect the right data and support, there are other businesses that do similar things, but for a different niche. Perhaps it's derm, perhaps it is maternity. It's a whole wide spectrum of women's health out there. How can we support each other and advance all of our businesses when we all have a special niche, the special cohort of women that we like to support, and then be able to go further together? And that is truly, at the end of the day, is we're not afraid to share. We're actually empowered by sharing. And for you, you're able to do that, hearing the voices of what they needed. And just like Amazon, do they care about competitors? When you have 3 different services, products that are all the same, but you have reviews, you have personalized way of treating your client. So we have to trust that we have a unique way to have client acquisition trial and be able to retain that. And just simply be mindful to say, they're not competitors. They're actually helping me to ignite my drive and my motivation to keep going. So that also brings up to our next question is, when you're sometimes in that early stage, perhaps we are a little fearful because money's on the line, people's on the line, and it is our baby, our passion. However, be able to spend the money in the right way and get awareness behind your brand in the early stages. what has been some of the right strategies you guys have dabbled into and now feel like, oh my gosh, what did I end up doing? And not feeling like we're throwing spaghetti at the wall.
I still feel like I'm throwing spaghetti against the wall today. But I really, for us, I think TikTok was a game changer. Honestly speaking, when I was first starting to raise our pre-seed round, and the bar on what investors want from us is just, it's always going to be so much higher than any other industry, and we just need to accept that for now. I can talk about it, but we can't change it right now. And I realized that the traction and what that meant was going to be really significant. And no, I was not going to be at 1 million ARR at pre-seed, but I was thinking, okay, how else can I show some kind of almost sometimes vanity metrics? And I kind of lent into playing that game, and for us, TikTok started to be this ecosystem where we could start getting viral content that was reaching 1 million people, 2 million, 5 million very quickly, and that really helped with our growth story. And then going to investors and proving that there was this conversation that people were having, were tapping into it, and being able to get that mass reach, which is fundamentally, if you're playing the venture game, they want to know that you have a brand that can scale. So that was something that I look back, and if we hadn't dabbled, then that was sort of 3 years ago, starting on TikTok, when people were advising me, don't play around with that like crazy thing, that's not going to be good for you, and this is your audience or millennial, this is like a Gen Z thing, and actually millennial women is the fastest growing demographic on TikTok, and it's a highly engaged segment as well. So that for us was a fantastic way to grow. And then I think the other initiative that, again, I'm looking back really glad we did, was to rebuild our zero and first party data sets, because you can grow your brand and community on different channels, but fundamentally, if you don't own them, you don't own that data, then it's a high risk situation. And so we started recommending products to women in a personalized way based on them completing a quiz on our website. So they would come and share information with us because they trusted us. And fast forward to today, we now have a really powerful data set around lifestyle and preferences and pain points and health conditions and even budgets. And that has allowed us to build an edge in the market. Again, when I speak to investors, they say, okay, we can see that you're straddling consumer and also data and tech, and that's confusing for me, but it's there's something in this, and I definitely think the data piece is really relevant to what we're all doing. Our communities are a really rich source of data and insights, and I think it's just knowing how to position that and talk about that in a way that investors can understand too.
Right, not keeping all your eggs in one basket of thinking growing TikTok, and then we now have issues about what's going to happen to TikTok, and then be able to drive these leads directly back to your own platform, and then your own platform is your email list, knowing how to capture them, whether it's a quiz, a giveaway, a checklist, some kind of value give, so you can continue to nurture them and get their insights. So how did you do, Amanda?
Yeah, no, I mean, on one hand, it resonated, and I think we are in a very unique position in that we are our consumer, that we are playing both roles, therefore we do really know our target market. And it is spaghetti at the wall, and it kind of becomes like strategic spaghetti. You're like, I'm gonna do penne, I'm gonna do rotini over here, it becomes strategic. And what I learned along the way was how important it was to really dissect who your customer is and various personas, right? Because sure, we have 86% of women trying to breastfeed, but they are all very different women. There's first-time moms, second-time moms, women living in a room with 8 other family members, and then single moms with IVF at age 48. Really dissect who your people are, and I think you get a better picture of where they are, and how to speak their language and gain that trust, right? Because when they do get to your website, they need to feel like this is for them, and they do trust you if they're going to provide their data, because we're not dumb, right? we know how this works. But in my case, I did not have money for a very long time, and for me it was try it all. I mean, mailing letters to pediatricians, pounding the pavement on the Upper East Side and throughout Brooklyn, just walking in to pediatric office. I mean, I just would show up and try back in pediatrics, be like, hey, show them also you. I think we tried the amount of money spent on brand packaging. I was like, I don't have that money, and I don't have any artistic background. And I had very early on someone say, you need to be present in this initial marketing because they're buying into this because of you, your idea, your acknowledgement of the gap and your creativity and your innovation. And if they don't see who's really behind it, we do not know, is it Procter & Gamble? Is it some dude? So I think that's something I had to really learn, and I was very scared. I was like, I don't want to put a video of myself on, it seemed very self-promoting, I think. But I realized that the first real partnerships I had was because they believed in me. And ultimately that turns into your investors, they believe in your team. It's not always about the numbers and the TAM, it is. But I think that's really, truly important. And then the other thing I'm realizing was different for you and I is in understanding those personas, understand what they're looking for, what they need, but how they go about getting it. So for us, when we threw spaghetti at social and when we threw spaghetti at Google Paid, our conversions were at Google Paid. Because when moms are crying, bleeding, screaming, they need help now. They look for it, they find it, they buy it. When they saw us on their feed, they were going, oh, cool, oh, that's cool. Brand awareness. I didn't know that term. It was great for brand awareness, but for our product, that's not when they bought, which I'm realizing for other businesses, particularly like skincare, and it makes sense. I'm not going to wait until I have the wrinkle. If I see something that's going to prevent the wrinkle, I'm going to click through. So I think it is. It's really knowing who's buying and differentiating between all the different types of your consumers and making it human-centered. Making your marketing strategy a human-centered process.
Right, and then that human-centeredness does have to come from you as the representation of the company. And some people, you were saying, and then even Amanda, self-promotion. Actually, we do deserve to promote ourselves. And if you trust yourself, it's not so much about, I'm being flashy. We have a mission that we're pushing. So we have to be able to learn how to tell your story the best way to convey that authentic side of all of us. And then it's showcasing the success stories, not just us talking about our product services, but let your customers tell their story and bring in all different aspects and then make it diversified, make social media edutaining, right? And then I think if for some degree, sometimes we can be too education focused when it comes to healthcare, and we feel like, people just need to know more. We need to give them more reason. Actually, they don't. They care about the result. They care about the screaming baby. They care about, I don't even know which tampon to pick. And then it seems like they're all uncomfortable. They needed to be able to get down the level. And for women who has mastectomy, all the even more serious issues, having that talk that as physicians, we're not good at sometimes because we don't have even time to even dive into it before our next patient comes. So having that community that you guys create, both on your own platform, TikTok, on any social media that where you people say is so important. And that also got into the next question of when you're thinking about the business model of B2C, test it out, there is a need. And then you start going to B2B2C. How do you convince the physicians, the companies, your partners, and your investors that you deserve to be at the table, that you deserve to be supported, and they should be a champion for you?
I can talk a little bit about this because for me, on the clinical side, we had all that evidence. This was clearly a solution that was evidence-based. It was obviously going to impact healthcare for 2 generations. The cost savings were already painted out. So I went right to the B2Bs, to the payers. And I was like, guess what? I can help you make your members healthier. And they were like, great, not really interested. And I was like, what? I mean, it was a very sad moment of truth. And like I said, then I had the providers and the investors, they didn't believe in what we were doing. And so I had to go direct to consumer to prove that this was a solution for a market where there was a grave gap and a very high demand. And I'm so glad I did, because it proved and validated what we were doing tenfold over, to where we really haven't been able to get rid of the direct consumer. You know, we built brand awareness through creating a great product that our consumers, patients, everyone, all clients love. That allowed us to get the traction in many forms, and I think that's important. Is traction isn't all user volume, revenue. Traction comes in so many forms, and I think it's important to think about it in terms of the stakeholders you do want to go after. When you are looking at B2B opportunities, you have to understand what the value is to them. And for us, that looks very different to a payer, to a private payer, to Medicaid, totally different values, to a health system, a hospital, versus an OBGYN provider group, right? A PE-backed hospital system versus like a mom and pop, totally different. Employers, and then ultimately, because in some ways we were a dual-sided marketplace, what is the value to our IBCLCs and what is the value to the patients? And once you understand how to speak in their language, even if you don't like it, then you're able to really kind of make a little bit more traction using the data. I said this yesterday, please start your daily dashboards. I hate spreadsheets and I never did it, and then I realized I should have been doing it. Once you bring the data and you speak in their language, then it gets a little bit easier.
Right. It's finding another win-win situation is like, what do they need? How can we support you? And not just, hey, you have a gap, we'll fill it. And then it's just almost make them think it's not idea. I actually supported you on something that you didn't even know.
You came up with this.
Yeah, you came up with this, right? And then it's driving that awareness from your patient side to say, actually, oh, did you doctor and hospital don't have this service? Let us champion you, let us advocate for you to be able to go after, and so you can get the right support that you needed. Anna?
Yeah, I think that building a pure direct consumer offering is really tough. And I think for me personally, anyway, I started out building a brand, and it quickly became apparent that our offering could add value to employers. And so we lent into that, because so much of the early days is kind of strategic opportunism and needing to find ways again to improve the market opportunity and to get money through the door as well. And then what's been exciting recently is, as we've grown as a consumer business, again, seeing the potential promise there on the B2B side to be able to allow other brands and partners to tap into that ecosystem and community and insights and so on. So I think for us, it's been really beneficial that we've had many strings to our bow, certainly when, again, being able to champion to investors, because I think candidly have been very excited about the B2B side. You know, as a consumer business, as you scale, your strength on the insights also scales. How exciting. And so we've had to be super innovative about how to grow, and I think there are different schools of thought. Some investors think that you should just double down on one specific concept and idea and just be bullish and say no to anything that doesn't fall within that remit. But I think a lot of us here in the room have had to be a little bit more thrifty than that, and again find ways to grow our businesses. So yeah, if you ask me exactly which revenue stream is going to be the number one for Unfabled in 12 months' time, I couldn't tell you right now, because there's kind of competition between all of them. But yeah, I think at some point we will break through and then decide exactly where we are going to focus and double down on our energy, so that when we reach a Series A, it's very clear what the product market fit is, and we're still kind of throwing a few things against the wall to figure out which one that's going to be right now.
Yeah, which is about trusting yourself and let time carry on. that data point for you, and now rushing ourselves. And sometimes we're eager, right? Like we're like, how come we're not getting there already? And sometimes it's because the market and the situation and environment, at the end of the day, business is a gamble. And we have to take some trust and gamble on ourselves to be okay with it. And if you're seeing the traction, then let it be. And then if you can start weighing out one after another, yeah, you can actually start to put more energy into the one side. What about you?
I just was going to say, I liken this process a lot to preparations for childbirth. I think you find a lot of women preparing for their first birth, they devise their birth plan. And I always want to say, it's great to have a plan, but it most likely won't go that way. And it's kind of the same way, is we have our plan, and we probably have 3 different plans, but it really is a journey, and there's gravitational pulls, and then there's unexpected tailwinds, and then there's unexpected headwinds, and it's just being prepared for that and being okay with it not going as planned. You might get this, it just might happen, and you're gonna do just fine.
Yeah, it's to say it's okay not to be okay, and then we'll come up above the water at some point, and we'll be able to find the resources no matter what happened. We just have to trust ourselves. Things will just come in the right timing and the right resources. When we see opportunity, we're gonna go for it. And that also means when you see opportunity, it's actually about finding the right relationship that you're building. And because we cannot do this alone, we have to have the core teams stand behind us, as well as reaching out to champions, stakeholders, and bypass the gatekeepers. So how do you guys find the most valuable sense to build the right relationships so you can get to the right strategic partners, clients, when they, perhaps it is a big company, and then how do you get to those people to truly buy in?
I mean, hopefully some of them are in this room, yeah, I think it's something that can take time. Sometimes it's to do with making sure you have a clear message that is featuring across places like LinkedIn, and people know where to find you, and you start just being one of those faces and names that keeps popping up. I mean, for us, we've had a lot of fortune in things like startup accelerators, so we were part of Practitioner's with Client's first accelerator called Rewire Health Studio, where they integrated 6 startups from around the world, and then that morphed into a relationship with Haleon when Haleon was birthed. And then that morphed into a partnership last year where we were able to work with Haleon's women's health team on an insights project where we were able to leverage our community and channels to really help them validate some hypotheses that would feed into their strategy. And so, you know, when I look back, that was just a kind of a chain of events that really came from something really far upstream. I remember thinking, should I apply for this accelerator? So sometimes it's luck, but then, yeah, I think often we can help each other, and that really has just been such a theme throughout this conference. I find a lot of founders talking about ways that we can add value to each other's businesses, and one thing I'm really passionate about is data sharing and thinking about how we can come together to create more valuable data sets. But also I'm really excited to think about ways that we can kind of share distribution, because I know that all startups are really struggling with acquisition and marketing budgets. And I think there's real work to be done around innovating through acquisition channels. And we've got a partnership with Simply Health in the UK, they're the biggest health insurer, and we were their first women's health partner. And so that for us is another B2B2C stream. And so it's just kind of a combination, I think, of partnerships, sometimes relative opportunism, and then just keeping on showing up. I think sometimes we feel like not being present and wanting to kind of fall into a hole, but that's the founder job, right? It's just to keep coming out even when you just don't feel like it at all.
Being able to show up for yourself, even in these really early stages where you kind of lack a little confidence, and that imposter syndrome is as present as it's probably ever going to be. It's still there. But the more people you meet, the more people you talk to, even when you're uncomfortable. I went to my first networking event, and as a nurse, I was an ER nurse. You don't network. You need an ID. I'm putting it in. I'm not going to talk about it. I'm not going to negotiate this partnership. So it was very unfamiliar to me to have to go up to some stranger, tell them all about me, hear all about them, and then conjure up some ask or a give, and it was this very unfamiliar thing. However, when I approached it in the mindset of people will help, and I started to discover that people were scratching my back even when I couldn't scratch their back. And particularly in the female founder set, in the healthcare set, I had so much give come at me over the last 7 years. I was the recipient of so much help. I think you have to not be aggressive, but aggressively go out and meet those people because they will come back and help you. I had talked with Care First, I had talked with everyone, and our first big partnership was with Women's Health USA, a huge OBGYN, and it was because of a mom friend I met at the elementary playground's husband's introduction. I mean, that's how it happened, and as terrified as I was to go into that meeting, it was the easiest meeting I've ever been in. They were nice, there was no boardroom, I needed no deck. I didn't even need to sell it. He goes, I get it. How do we do it? Let's start. Let's just get a pilot. We'll just run through that pilot for paper's sake, and then let's roll this out. Oh, okay. So be nice, be kind, be genuine, meet everyone you can meet, talk.
Well, yeah, we believe in, it's not really 6 degree separation, it's the first degree. And then one of the formula I have for everybody that go to conferences, within 60 seconds, you should have the first 40 seconds to talk about you. You deserve to be spotlighted. And then is, what's that one specific ask? You can't be talking about 5 different asks. No one's gonna remember it. If you don't have any asks, nobody knows how to help you. And then you wrap up the last 10 seconds to say, how do you get back? What is that? That's either it's involved with your company or personally, something that people don't even know about you to get back. So then it's a giving and take. Then we're sharing resources. Then we really make ourselves more memorable, and then just having the same conversation over and over again. And actually from all of us, relationship does take time to build, and a lot of us are going to be in this conference and have amazing conversation, then perhaps we're going to forget about ourselves. Except we add each other on LinkedIn, right? Sometimes when you post, yeah, I'll pop up, I'll make a like and comment. But how do we truly support each other ongoing? Perhaps, especially for an investor, they love hearing your success story. So every once in a while, send her a message. This is how much we have done. I got this award. We presented at this event. Oh, I'm actually in town in this area. Would you like to meet? All those little touch points, even though you didn't think that much about it, it actually mattered a lot.
Wow. And that is true. In terms of those future B2B partners, just those early conversations you're having, you can always ask, hey, would you like me to keep you updated on our progress? And have some sort of process for yourself of getting used to those future investor updates. Well, provide those updates to the people in your network that might be curious, because that person who may not make that introduction now because you're early, in 1 year, when they've seen you grow, now they actually will pull the card out of their pocket that they had in there that you didn't even know they had in there. So cultivate your network and be more organized than I was, because I still have like piles of cards that I, again, find a good operations person if you're not operational. But check in with them. Find a way, even if it's templates in Gmail, and schedule sends. Hey, I met someone. I really want to make sure I follow up with them. Put it on your calendar, review every 2 months. Set up systems that work for you, but it really does behoove you to try to collect people and hold on to them, because they are really good.
Yeah, for me, the biggest win I found is I do quarterly shareholder updates, and after that, I do a very stripped back version and send it to my professional network, which contains a lot of investors in it, every quarter. And it's been a really amazing way to keep people involved in our journey, to make them feel excited. And I think one thing I wish I had known at the start of my journey was how long it takes to build trust with investors. I remember thinking, if I do my job well, surely, and if they like me in the business, the money can come in the next day. And sometimes it's taking years. And I think now we're at a point where we've got some really amazing people who've been following us, taking an X-ray, is it all coming quicker than it has before. But yeah, I think it's just about the hype, right? It's about the FOMO, it's about sometimes it's smoke and mirrors, like what's going on inside is sometimes a bit ballistic, but the outside world, wow, LinkedIn is great, it's just great. My goodness, you no idea what happened this week. But yeah, it's a fun illusion, and I think for me just personally, it's a big breakthrough in the last 6 months. Has just been trying to really enjoy the madness of it all a bit more, and not feel kind of imposter syndrome actually for that disconnect sometimes between what people see from the outside and what's going on the inside. I think it's just now pretty funny, so try and enjoy it as much as I can. Yeah.
Good approach. Yeah, and it's at the end of the day, it's our relationship building, whether it's with the outside, external team, and the internal environment. We just have to find a way to say there is the empower system that we can create for our own niche and own circle. And when people are not ready to run with us, it's okay, right? You can stand on the sideline, but the rest of us going to keep going. And then the right people will always jump on the bus and are willing to help you even build over whatever mountain that you're trying to do. So we just have to believe in ourselves and continue to reach out and have a very clear value proposition to say, this is what I'm about. How can we do this together? And I appreciate you ladies to be brave to have built your company for where it has been and deserve to be celebrated. I think all of us deserve the pat on the back, and then sometimes we forget we really do deserve every single milestone that we have achieved. So thank you.
Thank you very much for the very inspiring panel. Had lots of fantastic key takeaways for founders in the room, for innovators. Again, collaboration was mentioned, building relationships. And Hannah mentioned about data collection and data sharing, which does tie in quite nicely to a presentation that we have just after the lunch break where we go into a bit more detail about that. That being said, we are now on the lunch break, so please do help us afterwards some food. Just as a reminder, at 1:20 p.m. we will be having the Founder Forum in Forum C, so just next door where the roundtable took place yesterday.
As we wrap up, let's talk about the major key takeaway from our discussion. Number one, mastering direct-to-consumer marketing in women's health and wellness. Number two, leveraging TikTok and Shorts for exponential growth in the health tech space. Number three, building strong investors' relationship to fuel health tech startup expansion. Number four, dominating digital marketing strategies for women-focused health initiatives. And number five, engaging and retaining female consumers in the evolving healthcare industry. Both Hannah and Amanda shared their experiences navigating the challenging yet rewarding world of Femtech entrepreneurship. They offered invaluable insight on overcoming obstacles, securing funding, and scaling their businesses in this competitive market. As we dived into the importance of user-centric design in health tech, as well as discussing how Unfabled and Nest Collaborative are addressing unmet needs in women's health, our conversation highlights the power of innovation in creating accessibility, personalized healthcare solutions. This panel also explored the future of Femtech, touching on emerging trends, potential collaboration, and the growing impact of technology on women's health outcomes. Now, I would love to hear from you. What are some of the Femtech innovations that excite you the most? Whether you are personally involved or have been exposed to some of the innovation, take a screenshot of wherever you're listening or watching our episode today, post it on LinkedIn, and tag me, Sabrina, Runbeck. Love to engage in a dialogue with you to see how we can continue to push the positive changes in women's health together. Thank you for tuning in to Provider's Edge podcast. We hope you enjoy our latest episode and found the insights and tips helpful. We'd love to hear your feedback on the show and learn what topics you'd like us to cover in the future. So please take a moment to leave us a review on your favorite podcast platform and let us know what you think. Your feedback is essential to help us improve the show and provide you with the content you need to take your healthcare business to the next level. Thank you for your support, and we look forward to hearing from you soon.